Coming up.
Super mum, super wife, supermodel. Let's talk about the bombshell that you've dropped.
Elle Macpherson's controversial choice.
I'm not here to be popular.
The supermodel
It was
defends
such a wake-up call for me.
her unconventional cancer treatment.
It's extremely important, and I trust you on this.
Welcome to the Extra Minutes podcast. Now, if you want to watch the full Elle Macpherson interview, you can do so on YouTube or 9Now. In the podcast studio with me this morning is Professor Fran Boyle to talk about the Elle Macpherson interview. Welcome and thank you for your time today. Firstly, let's talk about the cancer that Elle has been diagnosed with. What makes it particular? Give me some of its characteristics.
Elle has written in her book that she was diagnosed with intraductal cancer, and that is probably one of the most common types of breast cancer that we pick up on a screening mammogram. Often shows as little flecks of calcium. People usually don't feel a lump, and it's picked up because they're going along to breast screen and having screening done. And that's the best time to have breast cancer diagnosed, before it has a chance to jump out of the ducts that it's in and then have a chance to go elsewhere in your body. So perfect time to get your breast cancer diagnosed before it has a chance to spread.
That type of cancer, what is the best way to treat it, in your opinion?
So the best way to treat that intraduct cancer, or even pre-cancer we might call it, is to get it out. And if you imagine that the breast is a little bit like a series of trees with the trunks down here at the nipple and the branches coming back. Mm-hmm. If you take out this bit and it's got some cancer in it, but it goes up to the edges, you don't know whether there's a bit left still there or a bit left still over here. And you don't want to leave it there in the breast. You want to get it all out. You want a clear margin around it, and that might take more than one operation sometimes. And then if you've got a clear margin around it, often you'll give radiotherapy just to the breast.
Even if you have a clear margin?
Even with a clear margin. Right. Because we know that people who've had intraduct cancer once are more likely to get a future episode, and they're also more likely to get actual invasive breast cancer in the future. In other words, there's something about them that has increased their cancer risk. So it's kind of like a red flag. You want it out, but you also then want to think, what else can we do to keep that person safe in the future?
We learn during the 60 Minutes story that Elle Macpherson had 2 lumpectomies, but she had no clear margins.
And that's a worry.
You've described having further treatment if you have clear margins. If you don't have clear margins and you don't have further treatment, what's your prognosis?
Well, the worry is for Elle and for, of course, I understand there are reasons why she might not have wanted more surgery. She might have been offered a mastectomy, which removes the whole breast, and that's a good treatment for DCIS. If you do that, you don't need radiotherapy. But, of course, then you've got to face the challenges of, do I have a reconstruction? And particularly if you're someone who's in the public view, as she is, and skinny, that's more of a challenge. So she may have decided, okay, I don't want to go down the mastectomy pathway, and I can understand that. Then we would definitely recommend radiotherapy. And we would also recommend taking some hormone blocking tablets for probably 5 years afterwards to reduce any fertiliser, if you like, to the breast, which is estrogen, and to try and make her safer in the future.
Well, our understanding is that Elle chose not to do any of that. As you say, that is her choice. What do you think her chances are of it recurring?
I think statistically the chances of her having a future problem with breast cancer, or anyone in this situation, is probably about 1 in 5 or 20%. So, 4 out of 5 people will be okay. which is great. But 1 in 5 is pretty high odds of actually having another breast cancer event, and it might be invasive the next time round. So
meaning that it might have spread.
Mm-hmm. And breast cancer that spreads is what kills people. It can't kill you if it's still in the duct. So I really hope that she's getting very close surveillance, imaging on a very regular basis, and that she's in good hands for her ongoing care.
So the recurrence that you talk about, is that with or without treatment?
With treatment, it's less.
So
the risk of recurrence in the treated breast is much less if you have a mastectomy or radiotherapy. And in the other breast, it's much less if you take the tablets.
Mm-hmm. So Elle decided a different type of therapy, a holistic therapy, which involved dentistry and chiropractics and spiritual work and a whole protocol that she says is too complicated to explain on 60 Minutes. What do you think of that path of treatment? Does that secure her future, her life?
I think that's got everybody in the breast cancer world very worried. And I think for 2 reasons. I think it's that we're worried about her, but I think we're also worried that the message might flow on to other people with a diagnosis of breast cancer, that the only way to fix it is to go and sit in the dentist's chair and have all your fillings taken out and to be spiritually healed and spend a lot of money sitting in the desert for 6 months. And so they might, A, feel frightened because they know they can't afford to do that, and B, they might miss out on treatment that could be very useful to them to have right here in Australia, paid for by Medicare. So the affordable, good treatment for breast cancer is available to anyone in Australia. You don't have to be a millionaire and you don't have to go and sit in the desert. I think it's sending the wrong message. So we worry about her, but we also worry about other women hearing that story.
I mean, Elle says, she was diagnosed 7 years ago. She's here. She doesn't have cancer. She's in remission, she says. She looks amazing. Could her approach have worked? I mean,
her approach could have worked, and I think the stats would be 4 out of 5 times. You'd probably get away with that, and let's hope she's one of those.
When you compare conventional treatment of breast cancer to the protocols that Elle has described, is there any comparison scientifically?
There's no scientific background to what she's described, and it's expensive. The scientific basis of treatment is available, inexpensive, and can be done for anyone in Australia. So they're just absolutely chalk and cheese.
Why are people so easily swayed against conventional medicine then?
I'm not sure what's happening inside her head at the time she's treated, but we do know that people express a lot of shock. They're distressed. They're particularly distressed if they think they've been a very healthy person. And I think she'd already been a well person before she got breast cancer. So those people are often the ones who are just so shocked. How did this happen to me? They're often the ones who go searching for the reason why. And so they are swayed into someone who can tell them why. Now, modern science usually can't tell them why. We can tell them how to fix it, but we can't usually tell them why it happened. So for the kind of person who's a why person, I think they're the ones who are more likely to get swayed into an alternative approach.
Do you think they're getting real answers?
I don't know. It's hard to say. I think a lot of people are concerned about lifestyle factors increasing our risk of breast cancer, and there's no doubt that that's true. It's becoming more common. Alcohol, clearly something that she's publicly identified as a problem for her when she was younger, but not anymore. She's exercising regularly, which is a good message. She's eating well, she's not overweight, and she's having screenings. So there are lots of good parts to this story. She's doing a lot of things that have helped her, and we'd love everybody to do those things. But she's still got breast cancer. And I think that must have been a terrible shock. And I also think that if your body is part of your product into the world, then the shock of someone suggesting a mastectomy, which very much changes body image, sexuality, concerns about reconstruction and so forth, and being in the public eye, I can understand that that might be even harder for someone in her situation than for the rest of us who cover up and wouldn't really matter what was happening under the jacket.
Don't you cover up?
But her body is part of her product, I suppose, and part of her identity.
So she's trapped, really. She may be. She may be trapped by her beauty.
Which is sad.
Well, incredibly sad. If the impact is life-threatening.
Yes, exactly right.
Elle counsels others during her chat with Tracy Grimshaw to say, it's a choice. I'm not suggesting that you do what I do. She's not advising anybody to do what she's done. Do you think people will listen to that word of caution?
I hope so.
But what do you think instinctively?
Oh, I hope so. I hope they will listen and say she's made a choice that has suited her and she could afford to do so. You can make very good choices with the care that you're offered in Australia, and everybody will have slightly different things that matter to them. Some people, when they're diagnosed with DCIS, will say, look, get the bastards off. I don't care. They're trying to kill me. And other people will try and preserve breast tissue as much as they possibly can. Some will happily have a reconstruction. And what we know is that choice is actually very empowering and helpful to women, provided they've got the right information. And there is good information available through the Breast Cancer Network, for instance, on all of those choices. McGrath Foundation nurses play a really important role in helping people with complex decision-making when they're shocked and they need to chew things over. So I hope people will understand that good care is available here. You don't need to go to the desert, and you don't need to be worried that people are going to push you into a direction you don't want to go when you get breast cancer.
I guess what I'm trying to work out is what are real choices? Because, yeah, sure, there are people who can afford to go to the desert, and there are people who can afford to do what Elle has done. But is that the best guarantee of being healthy?
No, it's not.
So it's not just about you can't afford it and therefore you may not get the greatest treatment that Elle got. It's just that is not the greatest treatment if you compare it to conventional, in your opinion.
That's right. And I think the opinion of the breast cancer community is we would hate for this to be something that put other women in danger who are offered treatment that's appropriate for their cancer that might be invasive. And they've not joined the dots and gone, well, Elles was different to mine. I'm offered something for my invasive cancer, which can kill me. Elles, no, and she's okay. But my team and are they dealing with something different? And that would be a disaster if lives were lost in Australia. Women thinking, I can do what she did and not need to have conventional treatment. That would be terrible.
Is it your opinion and experience that women are swayed by celebrities, by people who look healthy, who have gone an alternative way?
I think people were very swayed by Olivia Newton-John's story, and there was a great affection for her amongst Australian people generally, but women particularly. And we saw a big spike in people going for mammograms when she was diagnosed, which was great. So we don't mind that. We breast screener ready to take you any minute now. Please go and have your mammogram. So we love that awareness that comes from a celebrity who's fit and healthy being diagnosed with breast cancer. And it's a wake-up call to everyone. Anyone can get breast cancer. Fit, healthy, unhealthy, anyone can get breast cancer, so please go and get screened. So that part of the story, fantastic. What isn't so helpful to people is a discussion about I had to take an alternative pathway for reasons very particular to myself and my cancer. And so you should do that too. And that, I think, is a real downside of the celebrity discussion of breast cancer.
And I wonder how much gets ignored too. I mean, if you look at the timeline of Elle Macpherson's treatment, she has a scan that identifies breast cancer as contained as it was, but then she does have conventional treatment in the form of lumpectomies. Could the lumpectomies be the reason why 7 years on, Elle Macpherson says she's cancer clear?
Yes, absolutely. And that's fantastic that she did that. And, you know, I'm sure the surgeons were very careful to try and advise her in that situation. And I'm sure they did their best to get clear margins. But you can't always see on an image what's happening in the breast. It's only the pathologist who can really see that once you've taken that lump out, handed it to the pathologist and said, did I get it all out? It's the pathologist who will tell you that. And I'm sure it was difficult, the decision-making for her.
Of course, and that's right. There's a mindset, there's an experience, there's an emotional toll, isn't there, on this? I mean, we can talk about it, and I hope we don't sound judgy, but we can talk about it in very sort of benign terms. When you're living that, the shock of that, the fear of that,
it's very difficult.
It must be awful.
Yeah, and we know that when women are diagnosed with breast cancer, they don't come to that from a level playing field. Some come to that from a history of domestic violence. Some come to breast cancer from incredibly good health. Some come from other illnesses that have increased their risk. Some come from families where everybody has breast cancer, and they either go and get a gene test and do the, you know, whole breast removal celebrity style, or they put their head in the sand and go, well, I'm going to be the one. And managing those families is tricky. But a lot of people come to breast cancer with other things going on in their lives, and it's like this big extra learning curve. It's like you suddenly get dealt a new university subject when you've already got a full-time job. And after hours, you're Googling and trying to learn what all these words mean at a time when your emotions are high, and it's very personal. So I think for any woman, we these days try and say it's not a medical emergency. It's not like taking out your appendix. There's actually time to think it through, make decisions, come up with something that is comfortable for you and safe, and not feel like you have to make your decision on the spot.
Is it because it's breast cancer that we approach it differently as women? Differently to other cancers, perhaps?
I think men with prostate cancer are often in quite a similar situation because the treatments for prostate cancer are quite tricky, and they do often influence masculinity and function in ways that men find distressing. I don't look after men with prostate cancer, but I think there's also a push in that environment to say it's usually not a medical emergency. Let's think it through, get some opinions, talk about the different ways to go, and to wrap your head around what's happening rather than to leap into it's cancer, got to get it out overnight. And so I suspect there's probably an element of that for prostate cancer as well. Probably less for things like lung cancer, where you're just desperate to stay alive, and most people will jump in and do what needs to be done.
Given that conventional medicine is increasingly positive in terms of results, life-saving results, the track record is getting better and better.
It is, yes.
Why, I know we raised this a bit earlier, but why are people still swayed, or can be so seemingly easily swayed, to an alternative path?
I don't think everybody is easily swayed. I think people who understand the data and who understand the statistics are usually pretty upfront with their decision-making. I think people who are very pragmatic will go, happy to get my breast off, but can it be on a Friday at 2:00 because that's when I've got childcare?
Yeah.
And people who are trusting of their healthcare professionals are often, if they like the doctor, quite happy to go along with things. So it's that fourth group of people who are why did this happen, I think, are the ones that modern medicine can't answer that question for them. And they're the ones, I think, who are more swayed towards taking an alternative pathway because their alternative practitioner will say to them, oh, it's your immune system. It's your unresolved grief. It's the fact that you didn't slam doors enough when you were a young woman, blah, blah, blah. And all that pent-up anger you've got. Who hasn't got pent-up anger? You ever met a woman who didn't have pent-up anger?
Not recently.
Yeah, they don't all get breast cancer.
No.
People who want to work on that stuff are often the ones who find the idea of chemotherapy or radiotherapy or surgery just foreign.
But I think as well there is still a suspicion about conventional medicine for some reason, like a suspicion of big pharma. That it's about profits, not health. That we're being sold a pup. I don't ascribe to that, but there are people within the community who do. They're the ones who are vulnerable to all sorts of people who are offering all sorts of miracle cures. I just wonder where that comes from and why it still persists in the face of statistics that show to take this path and your chances of living are going to be so much greater than anything else that we know so far.
I wish I knew the answer to that question because I think that's a group of people that we just haven't really reached very well. And they may have conspiracy theories about other things and they may be people who've had horrible lives and have lots of pent-up trauma. And I'm really pleased if they take this opportunity to get that fixed and see a psychologist. Like, we'd encourage anyone who gets cancer to see a psychologist. We make it happen because of the stress that's involved. And if they've got coping strategies from the past that are not very helpful to them, then let's sort that out if we possibly can. But there are people we just are not able to reach. And, I'd really love to know the answer. It'd be great for your listeners to tell us some stuff. Maybe they've had a bad healthcare experience in the past and that's made them less trusting.
And maybe the treatments themselves. That's often heard that people will say of chemotherapy, for instance, that the treatment is worse than the cancer.
It's definitely the case when you've got breast cancer that you're not unwell. So you come in the door well and we make you sick, but then you get well again and you'll be safe. So there is a need for people to understand that cancer treatment is walking this absolutely fine line between knocking off the bad guys and not too many of the good guys. To me, it's absolutely remarkable that we get away with it. Like, we are so careful that we get away with the cells don't look that different, but you can kill the bad guys and the good guys will recover. And
you think you do walk that fine line successfully?
And we absolutely walk that fine line. There's nothing cavalier about an oncologist, I can tell you, we're the safetiest, consciousest people in the world because we know that's a very fine line. It's called a narrow therapeutic window. If you imagine it's like an arrow slit and you're trying to get only the stuff that you can safely deliver out to that patient. And we're getting better at personalising breast cancer treatment. So there are new drugs that target specific aspects of cancer that are not as difficult as things in the past. And we know that one of the side effects of hormone-blocking treatment for breast cancer is hot flushes. It's like menopause on steroids. And there's a fantastic new treatment for hot flushes now available. So people are trying really hard to actually manage those side effects well so that patients can stay on treatment.
Elle Macpherson says she has no fear of her cancer returning because she believes she knows the source of it, why it was there in the first place, and she is approaching life in a healthy way, which will also help it recurring. Do you have fear for her?
I have fear for her. And I'm very pleased to hear she's under close surveillance. So you just, even if you feel well and you're absolutely certain it's not going to come back, please just keep doing your tests. Just be one neuron of fear and keep doing your tests. It's important.
I mean, ultimately, we do have to respect people's choices, what they think is best for them. But what is your message here? Just be careful of what those choices really are, or be careful of who you're listening to?
Be careful and take time to make good decisions. If you get cancer, take time. If you need to see someone for a second opinion, that's easily facilitated within our healthcare system. If there's something particular about that body part and what it means to you for your job or your sense of self or any other aspect that's very important to you, speak up, tell people, this is important to me because blah, 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 and I don't want to lose my hair, or I'll do anything but I don't want to lose my hair. I'll do anything but I won't have a mastectomy. You know, fix me around the things that are important to me. So speak up and be really clear with the treatment team, because there are ways around a lot of those things. Cancer treatment's not one size fits all. So if you get cancer, speak up about what's important to you and take time to make good decisions. And the second thing is anyone can get breast cancer, including Elle, so please keep up your screening.
Okay. Well, thank you, Professor Fran Boyle. Appreciate your time today and your insights.
You're very welcome.
Thank you. And remember, if you want to see that full interview with Elle Macpherson, tune in to YouTube or 9Now. Thanks for your time.